Good morning, everybody. My name is John Lodge. I am a director in a UK hospital based in London, a hospital called King's College. And in my role as a director of innovation there, I set up an innovation called Hexitime with a group of doctors in the UK NHS. And I'll just start with a bit of a quick story that led me to this innovation. I wasn't always working in the NHS. I used to be an army officer with the British Army, and by trade I was an engineer. Now, when I changed my career and I moved into healthcare, I did so with quite a lot of expertise and experience and a real deployable skill set that could be of value to my new industry. But the problem that I found when I started in the NHS with a brand new career was I had to go down several grades, several steps, and I was being used for simple tasks. And it increasingly led me to feel very frustrated that I couldn't deploy my full talent and expertise in my job from my previous work. And it was a real wake-up call, because I then started to look around at other healthcare professionals that were experiencing very, very similar experiences where they couldn't bring their full expertise and talent to the workplace. So it led to me teaming up with some doctors and creating this thing called Hexitime, which I'll very quickly cover. There we go. So many of you will recognize that most organizations, and certainly in healthcare, their biggest cost base and their largest area of investment is their people, their staff. It's the people at the end of the day that make everything happen. But despite them being the biggest source of investment and the area that we focus on the most and celebrate the most, we very rarely deploy them correctly. And why is this? Well, it's for two very common reasons we've identified that happen in the way we structure organizations. So firstly, we silo people into departments. So we have the radiology department that will do nothing but radiology. We have estates and facilities that will do nothing but estates and facilities. And within those departments, we define people and we understand people by their job title. So for example, a junior doctor is a junior doctor. They are there to learn and to complete clinical shifts. Now on Hexitime, a junior doctor is more than just their job description, more than just their pay grade. On Hexitime, and a real example here, a junior doctor may have a 3D printer and be able to use their 3D printer and their expertise in 3D printing to build prototypes for knee and hip replacements and share those with people in the health economy. They don't have to be defined by and limited by their job. So why does all this matter? Well, the problem with treating people by their job description, their job title, or their department remit is that they increasingly become dissatisfied and they become disengaged because they're not deploying all their skills to the core mission. Now, Gallup International Workforce Research is showing that on average about 80% of employees in organizations across all industries globally to some degree are feeling a level of dissatisfaction and disengagement because they can't bring their full talent to the table. On a global level, this is costing the economy about $6 trillion a year. And at a micro business level, what Gallup's research is showing is that this is just really bad for business. So it makes organizations less profitable. It affects sales, it affects retention. In healthcare, it affects safety. And these stats have been collected by Gallup for well over a decade now, and the trend is continuing to increase. And as a healthcare director, I wanted to do something about this. Now, what's really ironic and quite curious with this problem, with us not deploying skills correctly in organizations, is we then as managers and leaders, ironically, we go externally to fill those gaps. So we bring in consultancies or people on day rates or bank and agency shifts to plug the gap that, of course, 99% of the time we have the skills and the expertise within the organization that could be doing that job anyway, that we've already paid for. So what did we do about this? We created a time bank and a digital marketplace. So first of all, we created a software. It's a digital marketplace. People can offer their talents and expertise, and people can ask for them. But then what we did that's really smart, and to date we've picked up about 8 innovation awards for this intervention, is we introduced this time bank. So this is a digital currency where people exchange their time as a currency. No money exchanges hands between members of these communities. So with a digital time bank, it works basically like this. Let's say I need access to some data analytical support. I don't have the capability. So I put a request onto a market and ask for data analytical skills. And someone really helpful might come forward and offer me 2 hours of their time. In exchange for that skill, I then give them 2 credits on this digital marketplace. And now with these 2 credits, that person, that helpful person, can get exactly what they need. So let's say, and definitely not in this case, but let's say they need to translate something into English so they can do a presentation. They can then put that request on the marketplace and find somebody that can speak English and make that translation. And so what we're able to do is move skills around an organization to exactly where they're needed in a timely fashion with no additional cost. And in doing so, make people feel valued, part of the core mission, and satisfied in their work. And that's good for business. So, in quick summary, we created this tokenized time bank. We wrapped it around a digital marketplace and then created a really highly functional search engine so that within an organization, I'm not just looking at people's job descriptions based on an organizational structure. I'm looking for specific skills, and I can find those, and we can start to develop AI into that engine in due course. And then finally, because everything is digitally time-stamped on the software, we can understand and we can map exactly what's happening. And you'll see that here with one of our data visual maps, as we understand exactly what's going in the organization. And just finally, we've started to spread this across the UK, starting firstly with think tanks like the Health Foundation, customer bases across networks with purpose, hospital organizations, and we've just breached into the University of Warwick and taken this into health tech as well as a core innovation platform for people to create startup businesses and develop entrepreneurial business ventures with alumni. So that's Hexitime. It's a software that we're now offering globally and multi-industry, starting with healthcare and education. Thank you for listening.